Hello again, and welcome back to the Straight A Nursing Podcast. I'm Nurse Mo, and as always, really happy that you are spending some time with me today. This is mini episode 4 of 5 of our Say Yes to Success mini series, where we dive into a success-related topic for new and continuing nursing students. This series is sponsored by ATI, makers of the TEAS exam, and also makers of some great in-depth resources to prepare students for NCLEX and the world of nursing. For 5 weeks, we're releasing a new mini episode each Monday, so make sure you're following the podcast and following me on Instagram for some great giveaways and discounts, which I'll talk about when we get to the end of this episode. So I know a lot of students, maybe most, all, I'm not sure, but definitely a lot, are freaking out a bit about next generation NCLEX, or what we call Next Gen or NGN. So I attended a conference put on by NCSBN, the makers of the exam. I did that a few weeks ago, and I'm bringing you 5 things I learned about Next Gen NCLEX in hopes that it helps you feel more prepared and less stressed about the changes coming to this exam. And if you're not taking the NCLEX for a while, this still applies to you because your school will very, very likely be using Next Gen style exam questions all throughout your program. So let's dive into 5 key things I learned at this conference. For more information, a more in-depth look at Next Gen NCLEX, I want you to check out episode 156. Okay, so number 1 thing I learned at this conference was that the reason they're changing the exam is not to be mean. It's not to make things harder for students. It's because the NCLEX, as it currently stands, is not actually a true and accurate measure of clinical readiness. So obviously, they thought it was, used that version for a long time, but the research has shown that it was missing some key components related to testing your ability to make sound clinical decisions. This is actually not a bad thing, nor should you think that it's a scary thing. Making clinical decisions is what you will do all day, every day as a nurse. So don't you want the exam that says if you're competent to go do that actually tests you on the things that you'll be doing at the bedside? Now, for some reason, when students see change, the brain automatically goes to, it's going to be harder. This does not necessarily mean the test is going to be more difficult. The test is just going to be different and more designed to feel like real-world nursing rather than the whole test being a bunch of multiple choice questions. So this is a good thing. And honestly, if I were to go take the NCLEX right now, I'd much rather have an exam that mimicked real life and real clinical decisions than simply multiple choice questions. So if you're feeling scared because it's different, don't be, okay? It's just different. It's actually going to be better, and it's going to better predict that you're able to show up for your first day of work as a minimally competent nurse. And I know that's what you want. All right, number 2, and this one's going to make you really happy. Lab values will be included in test questions where applicable. So, hallelujah, right? I have been saying for years that memorizing lab values, memorizing those reference ranges, is a monumental waste of time. Because when I'm at work, when I go into the lab results section on the EMR, it shows me the reference range. And if it's too high or too low, guess what? It's red. And if it's really too high or really too low, guess what? There's an exclamation point. And if it's really, really too high and oh my gosh, way too low, there's 2 exclamation points. So I have reference ranges for me right there. And what was happening was students were spending all this time and stress and energy memorizing lab value reference ranges and not spending nearly enough time learning why this lab is important, learning what you do when a level is too high or too low, learning what you watch for, learning the clinical decisions that come with that. Okay, so when you're studying for your labs, and hopefully your school follows suit and doesn't make you memorize lab values, because why would they? If they're following next gen, they should be including that. They want you to understand what to do about it. So when I've got a potassium level of 6.4, is it more important that I know that is hyperkalemia, or that I know, holy cow, that's too high. I got to do this. I'm going to watch for this, this, and this, and I'm going to give this, this, and this to get the potassium level down. It all comes down to clinical judgment. Okay, so yay, that's a good thing, right? I hope you're feeling better about the next gen NCLEX already. Here's another thing that might make you feel better about the next gen NCLEX if the idea of change made you nervous, or you've heard some weird rumors like it's all essay questions or it's all case studies. No, the next gen exam will have a portion of the exam made up of the next gen style questions. The entire exam is a mix of those traditional NCLEX style questions and these next gen style questions. Okay, so if the whole idea of having the entire exam be completely different made you nervous, it's a portion of the exam. So I want you to take a deep breath and relax. Because you're listening to this podcast, I know a thing or two about you. I know that you are a dedicated student, and I know that you're willing to put in the effort to be the best student and nurse you can be. But it can sometimes feel a bit overwhelming. I know, I've been there, which is why it's so nice to have ATI at your fingertips. From passing the TEAS exam and getting accepted into a nursing program to graduating and passing the NCLEX, ATI is your go-to resource for anything and everything you need for nursing school. Now, for many of you, you're going to a program that uses ATI. If your school does, they have done you a huge favor. In 2020, schools that used ATI had NCLEX pass rates that were 5.8% higher than schools that didn't, and that is huge. And ATI helps you throughout nursing school too. In fact, ATI has helped more than 2 million nursing students graduate and administered more than 12 million assessments since the year 2000. So they kind of know what they're doing. Now, I went to a school that used ATI, and honestly, I felt so prepared, not only each semester, but when I took my NCLEX as well. And that's because the materials they produce are top-notch. They have more than 300 nurse educators on staff, so their ATI products and resources are carefully designed to actually help nursing students and set you up for success in life as a nurse. And if you're new to all this and trying to get into nursing school, then you may need to take the ATI TEAS entrance exam, and they've got you covered for that as well. They really are with you every step through nursing school. Learn more at atitesting.com. You can get official exam information about the TEAS and a ton of information about how ATI can help you get through nursing school and pass your NCLEX. That's atitesting.com. Now, the number 4 thing I learned at the Next Gen NCLEX conference was that a key thing you will be tested on is noticing. Noticing something is wrong with your patient and taking the appropriate action. So this is going to be kind of an underlying theme throughout the exam. So when you are in clinical or when you are in SimLab or going through a case study or listening in lecture, I want you to really pay attention on the things that you will notice that are going on with your patient. So in clinical, assess, assess, assess. Get your hands on as many patients as possible. Learn what normal looks like, feels like, sounds like. And whenever there's an abnormal, get your hands on those patients too. Learn what adventitious lung sounds sound like. Learn what crepitus feels like. Look at what an infected wound looks like. So get accustomed to the normals and the abnormals. Learn what tachypnea looks like, what increased work of breathing looks like. Okay. And then as the nurse that you're working with intervenes, observe what they do for the patient. You'll learn to recognize when something isn't right, and you'll start learning what people do as they make those clinical decisions. Now, if your school uses the Tanner model of clinical judgment as a framework, guess what? You're in luck. The Next Gen NCLEX is highly aligned with the Tanner model. And guess what a key component of the Tanner model is? Noticing. Okay. Now, this doesn't mean the nursing process doesn't have a place, but the key part of the nursing process that was kind of missing was noticing something was wrong in the first place. You're still doing your assessing. You're still planning your intervention, doing your intervention, reassessing. But the Tanner model pulls in that noticing component. And then the number 5 thing that I learned in the Next Gen NCLEX conference, and this one is probably going to make you the most excited, is that select all that apply questions are no longer going to be all or nothing scoring. It will use plus or minus scoring, which means that if you get a correct answer correct, that's +1. And if you choose a wrong answer, that's -1. So in other words, you get partial credit and don't miss the entire question just because you chose 1 or 2 wrong answers. So for example, if you have a select all that apply and you chose 4 correct answers and 1 incorrect answer, you'd get +4 for the 4 correct, -1 for the incorrect, and a total of 3 points for that question. Now, I know what you're thinking. What if I got 1 correct, but I chose 4 incorrect? Well, the good news is you can't get negative points. You would simply get 0 points for that question. Now, the reason they're applying this is because this is what real life is like. As a nurse, you have so many options for things that you can do at the bedside. Doing some of them is better than doing nothing. So you get partial credit in real life. You get partial credit on the exam. So that right there is probably cause for celebration. So if you're looking for a way to prepare for NCLEX, I really want you to take a look at ATI. That's what I used to prepare. I cannot say enough good things about their prep materials. The ATI Comprehensive Predictor is that end of program exam or exit exam that essentially is going to predict how prepared you are for the NCLEX. But there's also a lot more to it, and I don't want you to think of exit exams like that one as this task, just one more thing on my plate that I have to do to graduate from nursing school. It actually really helps you see where you stand when it comes to passing your NCLEX exam. So it's going to provide information on what you need to review, and it's going to boost your confidence for the things that you're doing really well at. And in that way, you're not going to waste your time studying things you already know. You're going to spend your time on the things that actually need review. Another great ATI resource for NCLEX prep is the NGN Questions Overview. And I love this because it provides next-gen style questions, but it does it in a no-stress way by utilizing non-nursing content. So it's not like you take these practice questions or play around with these practice questions with the stress of having to know the nursing content. You can get used to the format in a really low stress and low risk way. So that was the NGN Questions Overview. And ATI also has Board Vitals, Virtual ATI, and Live Review. So Board Vitals is this fabulous question bank of about 3,000 NCLEX RN practice questions. It has all those rationales that are so important to read, and it even uses adaptive quizzing so that it really mimics the NCLEX. Now, you might get Board Vitals through your school, or you can get it as part of Virtual ATI. So virtual ATI is pretty cool. It's a highly personalized NCLEX review. It's going to be completely tailored to your needs, and it comes with hundreds of resources that are on demand. Plus, and this is probably the coolest part, one-on-one guidance from a nurse educator who is essentially your virtual coach for the duration of the entire 12-week program. And then we have live reviews. These sessions cover test-taking strategies, critical thinking exercises, the NCLEX test plan, and the key material to review right before taking the exam. Now, you may have access to live review through your school, but if not, you can still access it by going to the ATI website at atitesting.com. So thanks again to ATI for sponsoring this episode and for generously offering a 15% discount to my listeners when you purchase $50 or more in ATIT's prep materials or packages at atitesting.com. So go there, go to atitesting.com, get $50 or more in ATIT's prep materials or packages. You'll get 15% off with code SAN15, SAN15. And then we're also doing a giveaway. So go to my Instagram at Straight A Nurse and find out how to enter to win a TEAS study package, a comprehensive TEAS study package. Look for the post with the words "Enter here to win" ATI giveaway number 2. All you have to do is comment there with the approximate date of your TEAS exam, and you'll be entered. Entries are going to be accepted through December 13th, 2022 at 6 a.m., and then I'll announce the winner a couple of hours later. So go to atitesting.com to explore all the ways ATI is there to help you prepare for the TEAS so you can get into nursing school, help you get through nursing school, and help you get past your NCLEX exam. I've put all the links and information I mentioned in the episode notes, and I will see you back here on Monday of next week for our final installment of the Say Yes to Success series sponsored by ATI. This podcast is brought to you by Straight A Nursing.